Hello, my name is Maggie Griffith, and this video presentation is for Assessment4, Remote Collaboration and Evidence-Based Care. For this assignment, I will be exploring evidence-based care plan solutions from the Villa simulation for Caitlin. Caitlin is a 2-year-old that was recently admitted to a Valley City hospital with pneumonia and malnutrition and newly diagnosed with cystic fibrosis. In addition to the severity and complexity of the diagnosis, several care coordination challenges presented themselves as well. Caitlin lives an hour away from the hospital in a town of less than 100 people, with potentially limited resources for care and information. There is also the family dynamic issue that her parents are separated and both work very long hours. The proposed care plan aims to address these concerns using current evidence-based practices, while also acknowledging the deeply individual needs of young patients and their caregivers coping with a life-limiting chronic illness. Dr. Anderson, the hospital pediatrician who diagnosed and guided initial treatment for Caitlin, listed several treatments that would become part of her home regimen. Fallon and Frey, in their article from 2018, illustrate that while treatment for CF is highly individualized, they cover the same basic steps as Dr. Anderson in terms of treatment, with pancreatic enzymes to cover reduced function of the pancreas, a 30% increase in calories to try to offset malnutrition, a regimen of fat-soluble vitamins, and the combination of physiotherapy and bronchodilators and surfactants for respiratory hygiene. Another part of Caitlin's care plan, due to an initial diagnosis of a complex illness, involves the educational and emotional needs of her parents. As Caitlin is still too young at 2 years old to understand her diagnosis, her parents' understanding and confidence in treating it is needed to ensure her best outcome. Edwards et al., in their article from 2018, revealed findings of a survey they sent to parents of young children newly diagnosed with CF regarding their perceptions of how they received information and education following the diagnosis. They found that their study, compared to several others, all revealed that parents turned to the internet to find more information about their child's diagnoses. Edwards et al. Stated that healthcare professionals need to give careful consideration as to how parents can be guided to credible information about CF. And I would include their recommendations to provide a list of credible websites and organizations, as well as the mailing of leaflets and videos if the home internet is a concern at Caitlin's house. It was also found from their study that most parents stated they would want to be connected with other parents of children with CF. Since the social workers noted there weren't any face-to-face groups available in their small town, Edwards et al. Stated that blogs and social media groups run by parents of children with CF were also effective in helping other parents feel supported. In regards to home management of CF, Sun et al. Stated in their study from 2017 that patients lack the ability to track their lung health at home, relying instead on doctor checkups, leading to delayed treatment and lung damage. While it is still newer technology, they developed and studied a trial of using a device that connects to the headphone port of a smartphone and interfaces with an application on the phone to test sputum samples to allow for tracking of lung health and possibly predicting an exacerbation. In their conclusion, Sun et al. Stated that in terms of portability, accuracy, and flexibility, this platform has shown promise for practical at-home pH monitoring of lung health for CF patients. This is one possibility that Caitlin's family could research to see if that or similar home monitoring options are possible to reduce the amount of trips to doctors and hospitals, and also to prevent a delay in care if Caitlin's condition changes. This study was included because of its potential to improve Caitlin's monitoring and care at home. However, none of the studies that were reviewed for this assignment showed a high level of adherence. Calthorpe et al., in their 2020 article titled Using Digital Technology for Home Monitoring, Adherence, and Self-Management in Cystic Fibrosis, explored 59 articles and 48 studies spanning 20 years from 1999 to 2019, and overall noted that in a condition where treatment burden is already high, home monitoring adds an additional task for the patient or family to complete. So while rapidly developing technology shows promise, there are barriers to overcome to ensure compliance for families that already have a lot of their time consumed in the care of a child with a complex illness. Quoting Sazinger et al. In their literature review from 2018, summarized that technologies vary in terms of cost, patient adherence and utility, effectiveness, implementation success, desired health outcomes, and impact on capacity. Pediatric patients who often lack access to specialty pediatric care, are socially, economically disadvantaged, or have chronic medical needs may especially benefit from telemedicine. The interdisciplinary team could plan to have a monthly teleconference meeting with Caitlin's family to assess compliance with her care, as well as assess and troubleshoot barriers as they present themselves. Her care plan so far was designed using the Knowledge to Action Process Framework, which Thomas Christenberry, in his book Evidence-Based Practice in Nursing, describes as 7 phases that include identifying problems that need to be addressed and begin searching for evidence and research about the identified problem, adapting the knowledge use to a local context, such as Caitlin and her family in a remote area, identifying barriers to use of knowledge, selecting, adapting, and implementing interventions, monitoring the use of those, evaluating the incomes related to the knowledge use, and sustaining appropriate knowledge use. In conclusion, cystic fibrosis is a complex and lifelong progressive illness. Parents of young children who are diagnosed with the disease are often overwhelmed initially by trying to understand the diagnosis, plan for their child's care, and adapt their lives to provide the time and finances required to effectively manage the condition. Special attention needs to be given to care plan, especially in a remote setting, to not only include all of the daily medicines and treatments, but in supporting the parents in the information that is given, the emotional support and connection that is provided, the use of telemedicine between providers and the family, and encouraging the exploration and compliance of remote monitoring options to improve safety, accessibility, and outcomes. Thank you.